Stiff joints when you wake up. Does it take you 10, 15, even 20 minutes before your hands and knees actually feel like yours again? You tell yourself it's just age, just sleeping wrong, just one of those things. But what if I told you that morning stiffness is actually your body sending you a very specific message, and the longer you ignore it, the louder that message is going to get? I'm a physician, and in the next few minutes, I'm going to walk you through exactly what's happening inside your joints while you sleep, why that stiffness happens, which causes are harmless and which ones need attention right away, and the simple things you can start doing today that can make a real difference. Stay with me, because by the end of this, you'll know exactly what your body is trying to tell you. Let's start with something most people don't think about. While you're sleeping, your body isn't doing nothing. Your joints are actually undergoing a kind of quiet maintenance process. The fluid inside your joints, called synovial fluid, acts like oil in a machine. It lubricates the surfaces of your bones so they can glide smoothly against each other. But here's the catch. When you're still for hours at a time, that fluid isn't being circulated the way it is when you're moving around during the day. Think of it like a jar of honey left in the fridge overnight. In the morning, it's thick, slow, hard to pour. Give it some warmth and a little stirring, and it loosens right up. Your joints work in a similar way. Lack of movement overnight causes that fluid to thicken slightly, and the tissues around your joints, the tendons, ligaments, and the joint capsule itself, also tighten up without regular motion. For most people, this kind of stiffness is what we call gelling, and it typically eases up within about 5 to 10 minutes of getting up and moving around. You shuffle to the bathroom, you stretch a little, you make your coffee, and by the time you're sitting down to eat breakfast, your joints feel more or less normal. That's a completely normal part of aging, and nothing to be alarmed about on its own. But here's where it gets important. Not all morning stiffness is created equal, and the duration, the pattern, and what comes along with it can tell us a whole lot about what's really going on. Let me give you a real-world example. Imagine two people, both in their late 60s. The first person wakes up, feels stiff in the knees and lower back for about 5 minutes, gets moving, and feels fine for the rest of the day. The second person wakes up and their hands, wrists, and feet are stiff and swollen for over an hour. It's not just stiffness. Their fingers feel puffy, warm to the touch, and they have trouble making a fist. By midday, things loosen up somewhat, but the joints still feel achy and tender. These two scenarios look similar on the surface. Both involve morning stiffness, but they tell two very different stories. The first is likely simple osteoarthritis, sometimes called wear and tear arthritis, which is incredibly common as we age. The second pattern, prolonged stiffness lasting more than 30 minutes to an hour, especially with swelling and warmth in the small joints of the hands and feet, is a classic warning sign of an inflammatory condition like rheumatoid arthritis. This distinction matters enormously because the treatment approaches are completely different. Osteoarthritis is managed with things like weight management, gentle movement, physical therapy, and sometimes anti-inflammatory medications for flare-ups. But rheumatoid arthritis and other inflammatory arthritis conditions need to be caught early and managed with disease-modifying medications, because if left untreated, they can cause permanent joint damage within just a couple of years. So if your morning stiffness is lasting longer than 30 minutes, especially if it's symmetrical, meaning it affects both hands or both feet or both wrists at the same time, that's not something to brush off as just getting older. That's something to bring up with your doctor. Now let's talk about another major player here, your muscles. Stiff joints in the morning aren't always purely about the joint itself. Sometimes the muscles and connective tissue surrounding the joint are the real culprits. As we age, we naturally lose some muscle mass and elasticity, a process called sarcopenia. Weaker, less flexible muscles provide less support to the joints they surround, which means the joint has to work harder and the surrounding tissue tightens up more easily overnight. Here's a catchy way to think about it. Your muscles are like the guy wires holding up a tent. If those wires are loose or weak, the tent pole, your joint, has to bear more stress and starts to wobble and creak. Strengthening those muscles is like tightening the guy wires. Suddenly, the whole structure is more stable, and that morning creak quietly disappears. Another major factor that doesn't get talked about enough is hydration and circulation. Many older adults don't drink enough water throughout the day, and dehydration can actually make that synovial fluid I mentioned earlier even thicker and less effective at lubricating your joints. On top of that, circulation naturally slows down a bit with age, and overnight, when you're lying still for 6 to 8 hours, blood flow to your extremities, your hands, feet, knees, decreases even further. Less blood flow means less warmth, less nutrient delivery to the tissues, and more stiffness when you wake up. This is part of why people often notice their stiffness is worse in cold weather. The cold causes blood vessels to constrict even more, compounding the issue. Now, let's talk about something that surprises a lot of people. Your mattress and your sleep position might be playing a bigger role than you realize. If you sleep on a mattress that's too soft, your spine and hips can sink into unnatural positions for hours, putting sustained pressure on certain joints. If you sleep curled up tightly in the fetal position every night, your hips and knees stay flexed for hours, and the tissues around those joints adapt to that shortened position. So when you try to straighten out in the morning, it feels tight and resistant. It's a bit like leaving a rubber band wound around something for hours. When you finally release it, it doesn't spring right back to its normal shape immediately. Here's a quick story that illustrates this well. A patient of mine, a woman in her early 70s, came in complaining of stiff hips and lower back every single morning, lasting almost 20 minutes. We went through her routine, and it turned out she'd been sleeping on a mattress that was nearly 15 years old, sagging significantly in the middle. We talked about getting a supportive mattress topper, and I also gave her a simple set of gentle stretches to do before even getting out of bed. Just slow knee-to-chest movements and ankle circles while still lying down. Within about 3 weeks, her morning stiffness had dropped from 20 minutes to under 5. No medication changes, no major interventions, just addressing the mechanical and circulation side of things. This brings me to one of the most important points I want to make today. Movement is medicine, especially for joints. I know it sounds almost too simple, but consistent, gentle movement is one of the most powerful tools we have against morning stiffness. The key word here is consistent. You don't need to run a marathon. In fact, for joint health, low-impact activities are often better. Walking, swimming, water aerobics, tai chi, and gentle yoga are fantastic because they take the joints through their full range of motion without pounding on them the way running or jumping might. Here's another catchy way to picture it. Think of your joints like hinges on an old door. A door that's used every day swings smoothly. A door that sits closed and unused for months gets rusty, stiff, and starts to creak and stick. Your joints are the same. Use them regularly through their full range of motion, and they stay well oiled. Let them sit unused, and they start to seize up. Now I want to address something specific. What should you actually do the moment you wake up, before your feet even hit the floor? This is something I recommend to almost every patient dealing with morning stiffness. While you're still lying in bed, spend just 2 to 3 minutes doing some gentle range of motion movements. Point and flex your feet. Make slow circles with your ankles. Bend and straighten your knees one at a time, bringing them toward your chest. Gently roll your shoulders. Make loose fists and then spread your fingers wide, repeating that several times. This is essentially waking up your joints and getting that synovial fluid moving before you ask your body to bear weight and walk. It seems small, but for a lot of people, this simple 2-minute routine before getting out of bed can dramatically reduce that first painful, stiff stumble to the bathroom. Diet also plays a role here, and I want to touch on inflammation specifically. Certain foods can promote inflammation throughout the body, which can worsen joint stiffness and pain. Things like highly processed foods, excessive sugar, and foods high in trans fats. On the flip side, foods rich in omega-3 fatty acids, like fatty fish, walnuts, and flaxseed, have anti-inflammatory properties. Colorful fruits and vegetables, particularly berries, leafy greens, and foods rich in antioxidants, can also help reduce systemic inflammation over time. This isn't about a dramatic overnight diet overhaul. It's about gradually shifting more of your plate toward anti-inflammatory foods and away from heavily processed ones. Let's also talk about something that's often overlooked: vitamin D and joint health. Many older adults are deficient in vitamin D, especially those who spend less time outdoors. Vitamin D plays a role in bone health, but emerging research also suggests it has a role in modulating inflammation and muscle function. If you're dealing with persistent stiffness and you haven't had your vitamin D levels checked in a while, that's a simple blood test that's worth asking your doctor about. Now, here's the part I really want you to pay close attention to: the warning signs that mean your morning stiffness is not just aging and needs medical evaluation. First, as I mentioned, stiffness lasting longer than 30 to 60 minutes, especially if it's getting worse over weeks or months rather than staying the same. Second, stiffness accompanied by visible swelling, redness, or warmth in the joint. These are signs of active inflammation, not just mechanical stiffness. Third, if the stiffness is affecting the same joints on both sides of your body symmetrically, particularly in the hands, wrists, or feet. Fourth, if you're experiencing morning stiffness along with unexplained fatigue, low-grade fevers, or unintended weight loss, these can be signs of a systemic inflammatory or autoimmune process. And fifth, if the stiffness is so severe that it's limiting your ability to do daily activities, buttoning a shirt, holding a cup, getting dressed, that's a sign it's time to get evaluated rather than waiting it out. I also want to mention something close to my heart as a physician. Don't dismiss new joint pain just because you're supposed to feel stiff as you get older. I've seen patients delay getting checked for months, sometimes years, because they assumed it was simply part of aging, when in reality they had a treatable condition, whether that was rheumatoid arthritis, gout, polymyalgia rheumatica, or even something related to thyroid function, since thyroid issues can also cause joint stiffness and muscle aches. The earlier these conditions are identified, the more options we have, and often the better the long-term outcome. So what's the takeaway here? Some morning stiffness is completely normal. A brief period of gelling that resolves quickly with movement is just part of how joints work, especially as we get a little older. But stiffness that lasts a long time comes with swelling, affects both sides of your body symmetrically, or comes along with fatigue and other symptoms. That's your body waving a flag, and it deserves attention, not dismissal. In the meantime, there's a lot you can do on your own. Try that gentle in-bed movement routine before you even stand up. Stay hydrated throughout the day, not just when you're thirsty. Build a habit of low-impact movement, like walking or swimming most days of the week. Pay attention to your mattress and sleep position. Lean toward anti-inflammatory foods when you can. And most importantly, if something feels different, if stiffness that used to last 5 minutes now lasts an hour, or if new joints are getting involved, don't wait it out for months. Bring it up with your doctor sooner rather than later. Your joints have been carrying you for decades, through every step, every climb, every hug, every dance. They deserve a little attention and care in return. If this video helped you understand what your body might be telling you, share it with someone who complains about their creaky knees every morning. It might just be the nudge they need to get checked out. And if you want more straightforward, no-nonsense health guidance like this, make sure you're subscribed, because there's a lot more we need to talk about. Take care of yourself, listen to what your body is telling you, and I'll see you in the next one.